So this is going to be a talk on low serotonin and the theory about how it causes depression and other mental illness, but I'm really subtitling this talk now, just stop the serotonin madness. Because most of this myth, and that's all it is a myth about serotonin, is just something created in order to sell psychiatric drugs, and then many people in the natural health field picked up on it also, and they realized it can be used to sell supplements, to sell all sorts of fancy functional medicine tests, and now we have this huge cultural myth that mental illness is caused by low serotonin, specifically depression, but it can be other ones, and this myth is totally detached from any attempt at rationality or science whatsoever. Looking right at an article from 2008 in JAMA Psychiatry, there was a study looking at the level of serotonin in patients with MDD or major depressive disorder. And the study actually concluded that brain serotonin turnover was significantly elevated in unmedicated patients with major depressive disorder compared with healthy subjects. And if we look a little bit more into this study, we'll see that they actually did attempt to measure serotonin by looking at internal jugular venal arterial 5-hydroxy-indolacetic acid plasma concentration. And that's a big mouthful of fancy words over there, but basically they're looking at the blood supply for serotonin and trying to measure as much as they can, as best as they can, in terms of figuring what's going on with flow of serotonin to and from the brain. Now, of course, when you go to a psychiatrist and they prescribe some medication to balance or normalize or whatever they say your serotonin, they're not doing a test like this. And likewise, when someone is trying to sell you a supplement like 5-HTP or tryptophan or B vitamins or any of those things, whether that's a person in a health food store or a nutritionist, some practitioner or the naturopathic doctors, whatever, of course they're not actually doing this test as well. There is no test to measure brain levels of serotonin. So the idea that people know your serotonin is low, that is mostly nonsense. There are some functional labs that look at whole body turnover of serotonin, but that's a little bit different. The point is that no one's looking at your brain and saying, oh, your brain has this much serotonin, so in this reductionistic fashion, we can say you need more serotonin or more precursors or anything like that. The bottom line is that all this just begs the question, when psychiatrists prescribe medications for serotonin, do they test jugular vein 5-hydroxyindole acetic acid plasma concentration? Or do they run some other similar test? You know what, if you're out there watching this and you have been prescribed some type of psychiatric drug, I am 99.9999999% sure that the prescribing psychiatrist did not run this test or run really any other test. For the most part, they just sit and they talk to people and they make up this stuff. How are you going to talk to someone and then come up with, oh, your brain level of this neurotransmitter is this or that? Like, where is this data coming from? It's literally just hypothesized out of thin air. So really, again, how is this serotonin diagnosis made? Well, they make it up. That's it in a nutshell, and we can go over the history of where this myth has come from and so forth, but the bottom line is that this is not based upon any type of physiological test whatsoever. There's no blood test. They're not doing a lumbar puncture. They're not doing CAT scans or anything. They are literally making this up out of thin air. And then when we go to the world of nutritional supplements, we'll see things like this. And this diagram was actually just pulled from a website selling nutritional supplements. This notion that there is, first of all, this one-to-one relationship between certain between certain neurotransmitters and emotions or functions. So the idea that serotonin is responsible for obsessions, or dopamine for attention, or norepinephrine for alertness. Now, it's not that these neurotransmitters don't play a role in these functions, but it's a very simple, it's overly simplified idea that there is a one-to-one relationship between this specific neurotransmitter and this specific function, and then this big leap that you can somehow fine-tune or adjust the levels of alertness or happiness, or by taking more 5-HTP for serotonin or more tyrosine to raise dopamine levels. The notion that you can fine-tune your neurotransmitters from the outside by taking in these amino acids and some other nutrients like vitamin B6, that is just coming out of nowhere. Now, first of all, certain people will feel better on this, and for those people who have some feelings of depression and they take 5-HTP, I mean, that's fine. And I'm not saying that those people don't exist, but the idea that everyone who has depression needs serotonin and will be fixed by taking 5-HTP, and this is the cause of depression, that's nonsense. And if you're actually working in the real world and seeing people coming in with depression or anxiety or bipolar disorder or whatever other type of mental illness they want to, a psychiatrist wants to label them, that this very simplistic model just breaks down immediately, and what you're left with is real people with real emotions that are caused by a myriad of many various factors. So the supplements, I'm not going to attack them completely like as if they're worthless, because they're not worthless. They can help people, but it's really overblown, the effect of what these supplements can do in terms of finally regulating mood. So some supposed mechanisms of actions you'll hear is that drugs like Prozac, Zoloft, Celexa, Lexapro, and Paxil, or any SSRI will work on serotonin. So what they really try to do here is they think that by labeling these sort of drugs SSRIs, or selective serotonin reuptake inhibitors, by just giving it that name, that'll somehow imbue these drugs with the magical powers of actually being selective serotonin reuptake inhibitors. Now, you can go online and find all sorts of images and videos showing how these drugs work at the neurotransmitter level in the brain, increasing levels of serotonin. This is made up theory. No real reason to believe it whatsoever. They did do studies, like when Prozac came out, looking at the effect the drug had on serotonin on platelets. So platelets are in the blood. They have a role in binding of blood together to form when you have wounds, so you don't bleed to death. That's where the action of serotonin was found. So there's a couple of problems with taking studies on platelets and saying this is what's going on in the brain. Number one, platelets are not in the brain. They're in the blood. Number two, these psychiatric drugs have effects all over the body. They affect just about every system. So even if the drug was affecting serotonin, how can you say that is the reason why the drug does whatever it does when it affects all these other systems and has all these other actions? So you can't, there's no such thing as side effects. The effect of a medication or a supplement or whatever is the totality of what it does. You can't just say, oh, one little thing that it does is responsible for the main action and everything else is just kind of on the side, but we know this one little thing that it does is responsible for the actual real therapeutic quality that it has. No, the effect of whatever it is that you're taking is the totality of all of it. Finally, there's no reason to believe that you can say depression is caused by low serotonin. So on multiple levels, this whole notion that they know these drugs work by inhibiting the reuptake of serotonin is complete and utter nonsense. That's it. And then you'll see many supplements that are sold supposedly because of their effect on serotonin as well. 5-HTP tryptophan. We know those are precursors for serotonin. We do know from certain functional lab tests that those will improve total body turnover of serotonin. But the idea that you're necessarily going to derive up serotonin by taking a lot of those supplements, I'm not really sure about that, unless your body wants to use it for that purpose. There are certain nutrients that can be helpful, but when we get into something like St. John's wort, again, that's an herb that usually often sold for depression or other types of mental illness. I mean, it's a great herb, but it's really marketed in a superficial way that doesn't respect the traditional use like many herbs. And you'll see discussions of how St. John's wort is like a natural SSRI. I mean, the first thing is that if St. John's wort was really a natural SSRI, you wouldn't want to take St. John's wort because the SSRIs, are so bad. Why would you want one synthetic or natural? But the second thing is if they don't know that the actual medications work on changing brain levels of serotonin through this whole reuptake theory, then how could they even know that St. John's wort works that way? Honestly, a lot of times when you hear these mechanisms of actions for herbs, they really are making it up. They don't know. All that they know is here's an herb, there's a physiological effect, so then they theorize some mechanism of action. A lot of what you'll hear in health, whether it's about how drugs work or how supplements or especially herbs work, is, in my opinion, a lot of theory and a lot less hard science than people are made out to believe. To understand the mindset that produces these very simplified theories, such as depression is caused by low serotonin, we need to look at really where this comes from, and it comes from reductionism. Reductionism is a philosophical position which holds that a complex system is nothing but the sum of its parts, and that an account of it can be reduced to accounts of individual constituents. So this can also be called like a Newtonian perspective. So under this reductionistic model, you'll hear things like thyroid hormone produces energy. So if you're low on energy, you need more thyroid hormone. It's very simple things. Or allergies are mediated by histamine. So if you want to fix an allergy, you take a drug that lowers histamine. Or you hear that psoriasis is caused by inflammation. So to treat psoriasis, you take a steroid drug to shut down inflammation. This very simple model. Now, it's not that reductionism is wrong exactly. It definitely has its place, and we owe much of the scientific revolution to the movement of reductionism in terms of allowing scientists to be able to break down complicated things to parts, understanding how those individual parts work. However, when it comes to complex systems like society as a whole or how the human body works, you can't really understand it using reductionism, because it's not that this little part does this function, that little part does that function, but that you have, end results or end functions that are manifested from the interplay of numerous interconnected parts. So we need to leave reductionism and go to a more systems theory or a holistic theory of health. But conventional medicine is really stuck on this reductionistic model, but further so because our society is so insistent on using reductionism to understand how the body works, we see this abounds all over the world of natural health in terms of selling supplements and all that stuff. And that's why we have very simple models and people being told take this supplement for serotonin or that for epinephrine, and so forth. When again, it's really going to be a systemic issue. You need a holistic theory to understand where these mental symptoms come from. You just can't get to the truth by looking at reductionism. At least there might be some instances where you can, and reductionism does have a place in health. Like if you have an anaphylactic response, you want to take a shot of adrenaline. That's a good example of where reductionism can play a good role in health. But for when it comes to all these mental symptoms, for the most part, we really need to start moving away from this reductionistic theory of this neurotransmitter or whatever does that, and look at how multiple different factors interplay and work together. So when it comes to simple ideas like serotonin is linked to depression, dopamine, happiness, reward center, oxytocin, love, and bonding, I'm not saying that there's no measure of validity to this. I'm not saying that these emotions cannot be manipulated by somehow initiating certain therapies that actually change the levels of these neurotransmitters. But my point is that you can't reduce these emotions or neurological functions down to just one neurotransmitter in this point-by-point relationship, nor can you just reduce these emotions down to simply neurotransmitters, that it's more complicated. So the problem is that emotions are complex. We have many neurotransmitters working together, and it's not all understood. So perhaps if neurotransmitters are off, it's for a reason. For example, chronic infection can lead to depression. That's because if someone is really sick, the body wants to go into more of a hibernation mode to preserve energy. It's a mechanism for survival. It's a necessary adaptation. It's not a problem that needs to be somehow altered with medications or supplements. If you're depressed because of chronic infection, you need to work on the immune system, not take a psychiatric drug and not take 5-HTP. Obviously, hormones can affect mood, like estrogen, progesterone. We see that in PMS. If that's the case, the way to fix the problem is not by artificially changing estrogen and progesterone levels through taking birth control pills or loading up on progesterone supplements or bioidentical hormone replacement therapy or anything like that. If that's the case, you really need to step back and ask the question of why the body is shifting the hormones, in this way. And usually with PMS related depression or anxiety, you're going to see an issue with stagnation, especially in the liver and gallbladder, and I need to help with detoxification. And I'd much rather work with people on a causal level and help the system that needs help, rather than saying, oh, the effect of all these imbalances is depression, so let's try to force you to be happy. Even if you could force someone to be happy through the drugs or supplements, I think in the long run it's much better for people to work on the root cause. Obviously, psychological trauma can cause many different mental symptoms, and from a perspective, this is the body adapting to the environment. If someone is in an abusive relationship where there's a lot of fear, where they might be injured, it's going to be adaptative for their survival to feel depressed and go into a more hibernation mode. In many ways, depression can be thought about as a adaptation to the environment to get someone to kind of hibernate or hide from external dangers. That's one other perspective. So even if neurotransmitters are off, maybe they're off for a reason. Fixing lab numbers is not truly holistic health. Whether you're trying to artificially fix cholesterol numbers or a lab, or if someone runs a functional lab test and tries to artificially fix your neurotransmitters to make the some lab test look better. When it really comes down to it, I would look at any case of mental symptoms and say, even if your neurotransmitters are off, there's probably some reason for it. The body is doing that in an adaptive response to some problem, or the body is doing that because of frank nutritional deficiency, something like that. It's not because of some inherent brain defect and someone needs some drug. We would need to have some more information to show if that's true in any of the cases. And we need to be aware of this doublethink that's going on in the world of psychiatry, or even the supplement industry, when they try to sell people these drugs or supplements. So if we go to the WebMD article on these SSRIs, NRI medications, I have the link right there. The top of the article says that the truth is that even experts aren't really sure how antidepressants work. Now, and if anyone does a little bit of research, that's what they're going to find. They don't know what these drugs do. They don't know how it works. But after stating that at the top of the article, but then later on, the same article says serotonin and norepinephrine reuptake inhibitors block the reuptake of both serotonin and norepinephrine. So if they come out and they say, we don't know how this works, how are they able to then give this very reductionistic or mechanistic explanation of how they work? This is cognitive dissonance. This is doublethink. This is them saying one thing. It's like psychiatry is covering its own ass and coming on just saying, okay, we really don't know what's going on, which is the truth, and then they go on and they give this mechanistic explanation because it sounds good. It sounds scientific. It sounds like there's some researchers in a lab who have it all figured out. That's why this stuff helps to sell the drugs or supplements. But the fact of the matter is, it's made up theory. There is no proof that these psychiatric drugs work by blocking the reuptake uptake of both serotonin and norepinephrine. If they had the proof that that's how these work, then the article would not state that the truth is experts aren't really sure how antidepressants work. Because if they had that proof, then they would know how antidepressants work. And I could go on and show further evidence that they really have no clue what these medications are doing. So a lot of this theory came from the world of psychiatric drugs, where they'll give someone a drug and they'll notice some supposed effects, and then they theorize, according to some mechanistic ideology, how the medication must so-called work. So really, it was in the late 80s that Prozac came out, and Prozac had this serotonin theory. So then they just kind of said, well, we theorize that serotonin is involved with depression because we believe Prozac is affecting serotonin based upon platelet studies. So therefore, depression is caused by low levels of serotonin. I mean, it's really that simple. And I hope it's obvious that there are so many various factors that can affect emotional well-being that are just thrown out of the window based upon this very simple model. But to make the point that no matter what they say about Prozac and its mechanism of action on serotonin, they really don't know what Prozac does. If we go to the prescribing guidelines of Prozac, and you can do this with any medication, if you don't want to read all the advertisements and all that, you can go to the medication's website and download the prescribing guidelines. So this is kind of like the guideline instructions that medical doctors can look up when they kind of want to know what's going on with this medication. So under prescribing guidelines for Prozac, under mechanism of action, it says, although the exact mechanism of Prozac is unknown, it is presumed to be linked to its inhibition of CNS neuronal uptake of serotonin. So basically what they're saying is they don't know what it does. They have no idea how it works. It's completely unknown, but they will just presume that it's linked to this whole central nervous system neuronal uptake of serotonin. Presume means to assume. They're just going to make this assumption out of what? Out of thin air. If they knew that it was definitively linked to serotonin in the central nervous system, it wouldn't say presumed. It wouldn't say that the mechanism of action is unknown. If they knew this is how it worked, then it would say Prozac works by inhibiting CNS neuronal uptake of serotonin. But again, this is the double think. You sort of WebMD, you're seeing it in the prescribing guidelines. They don't know how it works, and then they tell you how it works. It's one or the other. They can't have it both ways. And then it says right underneath that studies at clinically relevant doses in man have demonstrated that fluoxetine, that's Prozac, blocks the uptake of serotonin into human platelets. So they did some study on platelets. They saw that one of the many, many different things that this serotonin can do is affect somehow the effect of serotonin on the platelets. And based upon that, they came up with all this central nervous system activity, how serotonin and low serotonin causes depression, and it does this in the brain. And that's why you can go to YouTube and watch these models of serotonin doing this to these neuronal axons and so forth. And it should be so painfully obvious that this is made up nonsense. This is fake science. This is bullshit marketed in order to sell drugs, and when people use this to sell supplements, for the most part, they're just tagging along to the money train. Now, I do know that there are many people who will use certain amino acids, like tryptophan and 5-HTP, and again, it's great if you're using it for depression or anxiety, and it helps. If you're doing that, fine. It works. It helps certain people. But it's really so overblown, the idea that if you are depressed and you want to treat it naturally, you run out and take these amino acids. That is a huge simplification of the matter. Now, in my field and in the world of, natural healthcare practitioners, we have something called functional medicine, where there are specialty tests that aren't typically run through a conventional medical doctor, but more alternative-minded practitioners will run these lab tests to supposedly uncover the underlying functional cause of illness. And we have certain tests that may be valid or helpful when it comes to mental symptoms like depression or anxiety. For example, you can run an amino acid blood test and look for levels of tryptophan, tyrosine, and other amino acids. And amino acids can be important because they are precursors to neurotransmitters. That's one of the reasons why they can be important. And another example of these tests is something called an organic acid test, where you can measure byproducts coming off of the serotonin pathway, like 5-OH indolacetic acid. If that's elevated, it means that there's high levels of turnover of serotonin throughout the entire body. This is not brain level, this is body level because it's a urine test. There's also quinuric acid or quinolinic acid, and if those are elevated, that can show there's an underlying inflammatory condition which is inhibiting the conversion of tryptophan or 5-HTP into serotonin. And so there is a place for these tests. It could be helpful. I have a video on neurotransmitter testing for depression and anxiety, so I wouldn't make a video about this sort of testing if I didn't think it was valid, nor would I make that video if I thought that there was no role in amino acids or other therapies designed to maybe give the body precursors to neurotransmitters. I wouldn't put videos out about if I didn't think there was some validity to it. I wouldn't have pages on my website if I didn't think there was a measure of validity to it. But my big gripe with this functional medicine approach is that you can have people who go into a practitioner's office, whether that's an integrative doctor or a naturopathic doctor or someone else, and they'll say, I'm depressed, and right away they're led down the route to this functional medicine approach without even looking at the entire case. So this is one consideration. It's one possibility if the total case says look in this direction. You cannot reduce cases of mental symptoms down to this. So just use it as a tool, just like a stethoscope is a tool. And sometimes if there's a cardiovascular problem, you can pick up on the stethoscope. Other times you can't. Sometimes if there's some type of mental symptom issue, you might pick up some things helpful on this sort of testing, and sometimes you can't. But you really need to look at the total case. Like if someone has post-traumatic stress disorder and they're in they had some situation with domestic abuse at home, you can't say, oh, you're depressed because your serotonin is low. Maybe the serotonin is low because they have some spouse beating them. I mean, that's a severe example, but you really want to drive home the point that you have to look at the entire case. You can't just run to these tests off the bat without consideration to the entire person. So not all natural therapies are holistic. From a holistic perspective, the causes of illness aren't that complicated. These are the things that can cause illness. Nutrition as nutritional deficiencies, toxicity, bringing things into your body that don't belong there. So you basically need to give your body good stuff and take out the junk. Obviously, psychological or emotional stress, that can cause mental symptoms, and that can cause physical symptoms. And physical trauma, like if you get into a car accident, that can cause injury, and of course that can lead towards mental symptoms. A problem on the physical level can cause mental symptoms on the emotional level, and a problem on the emotional level can cause actual physical symptoms. So it can go back and forth. That's why if you're really looking holistically at anyone, you have to look at the physical and the emotional, and try to direct treatment towards the root cause. A lot of times for mental symptoms, I go back to basic Chinese medicine theory, 5-element theory, where there are different emotions associated with different organ systems. Like, for example, grief is associated with the lungs. And, that should be somewhat intuitive, such as if there's a loss, if someone has a major grief, they're going to cry. And crying, that's something that's coming out of the lungs, as there's a lot of respiratory symptoms there going on at that time. Or, the kidneys are associated with fear, which might not be as intuitive. The liver and gallbladder is associated with anger and irritation. Well, anyway, the point is that if there is some issue with an emotion, there might be an underlying problem with the organ system. And this can become very complicated, more complicated than immediately obvious based upon the chart. Like, for example, issues with mania might be associated with the kidneys and the urinary bladder, for example. So even though I'm not an acupuncturist, I have a lot of appreciation for traditional Chinese medicine theory. And even if you don't stick needles in someone, you can use the theory to direct a nutritional device or the use of supplements, or knowing to look in a specific area. If someone is angry a lot of the times or irritated, then you might need to support the liver and the gallbladder. Maybe the reason they're angry is it has nothing to do with serotonin or the neurotransmitters, but has to do with the fact that there is stagnation in the gallbladder, and maybe they need herbs like milk thistle or dandelion or phosphatidylcholine. I mean, that's a kind of simple example, but a lot of times, this stuff can help and it can give you a way of looking at the underlying imbalance that's not readily available through this very reductionistic neurotransmitter theory. And to finish up, just summarizing the difference between a really holistic treatment and reductionism. Holistic treatment, you're going to give the body what it needs. With reductionism, there is an attempt to force something on the body. So, for example, with serotonin, let's just say for the sake of argument, serotonin is low. From a holistic perspective, you want to ask why is serotonin low? If someone needs 5-HTP or tryptophan, you can give it to them. But if the problem is elsewhere, you're going to go elsewhere. Whereas with the reductionistic approach, if you see serotonin is low, then people are going to start to try to force serotonin up by taking more and more 5-HTP, or they'll take more vitamin B6 and more magnesium and try to overdose in all these precursors, amino acids, and vitamins in order to try to force something. You shouldn't have to force an action on the body if you are really addressing the problem at the root level. From a holistic philosophy, mental symptoms are a manifestation of the total stress on the body. Again, look at the physical problems, look at the emotional problems. From a reductionistic perspective, you say the brain thinks, therefore the problem is in the brain. Mental symptoms is a brain problem. So from this reductionistic approach, you can't say, oh, your mental symptom is due to an issue in the liver or the gallbladder or the kidneys, for example. Whereas, from a holistic model or Chinese medicine model, a homeopathic model, you're really leaving the brain and you're looking at the entire person. Finally, holistic treatments are going to tend to be gentler, whether it's someone's getting acupuncture or homeopathy or flower essences, some changes in nutrition, maybe reducing something someone's allergic to, whereas reductionistic therapies are going to tend to be more aggressive. Now, psychiatric drugs and really stupid things like electroshock therapy are, of course, very, very aggressive. But you also tend to see that when working from a reductionistic approach, from people using supplements, they're going to use higher doses of more single nutrients. Well, actually, sometimes I might use a lot of different nutrients, but that's when you'll see people taking huge doses of B vitamins and huge doses of amino acids to try to force something onto the body. Whereas if you're taking the right nutrients, or if you're really taking the right homeopathic or flower essence that's really appropriate for you, then you don't need to take huge amounts. You're simply helping the body, giving it what it needs so it gets better. Now, there are certain cases where people are not in good situations, and even though I'm trying to work holistically with them, I'm using an awful lot. So I don't want to overgeneralize this, but generally speaking, it's simpler to work holistically than to try to force something onto the body. I hope, and for anyone who listened to this, that I was entertaining and followed along and it made sense. But this video is a little more my frustration upon person after person believing that they have some type of mental symptom such as depression or anxiety because of some neurotransmitter defect, when it is simply not the case at all. And I wish that we could just get over this cultural myth. And I say cultural myth because it's not even a medical myth anymore. All the psychiatrists know this is nonsense. Everyone knows it's nonsense, but yet it's constantly out there and used to sell stuff. And, that's my real gripe with it. Okay, thanks for listening. Bye.